we can just talk on case taking, how to take a case.
No, I don't know. I don't know.
Okay, so we need to continue with the session. Just about case taking itself. So as a homeopath, I think I am just opening the discussion to you. As a homeopath, we need to be very keen. While a person is entering in our clinic, we need to be very keen and we should be very welcoming that we need not be anything prejudiced, or we need not make our character or anything in front of the person and try to stop the person, or anyway we need to obstruct the person when he is going to what we narrate the case. That's the thing initially we need to do as a doctor. Whenever a person is entering our clinic, our chamber, and coming itself, entering the room itself, we can decipher a lot of things on the person. How he is entering, how he timid, is he afraid, or is he very bossy, or what type of personality is the these things we can watch from his attire itself. That's a cardinal thing which we can get whenever a person is coming inside the chamber of a homeopath. So while taking a case, the case when he is going to narrate, he will be just describing the case initially with the complaint which he is being annoyed, which he is troubling. The most troublesome thing will be explained in detail in the initial time itself. So this is also very cardinal. This thing will be the most important symptom, which means the trouble which he is going to be exhibited. That should be considered, and that is the presenting complaint. And we need to elicit how, when it started, and what the depth of the complaint is. This is the thing we need to see while taking a case. And with that, as a homeopath, we need to know more about the other symptoms which the person is having, the importance of the other symptoms and the totality of the symptoms itself will only lead a minimum medicine to be get selected. This is the usual thing which we need to have in mind when we are going to take a case, or the thing to be considered while taking the case. And we need to have a discussion on these things. And I welcome Dr. Dhanesh for something to add on this.
We can call Dr. Panduranga.
Dr. He is not practicing. He's just came here out of passion, and for about 15 years since from 15 years he's not practicing or doing anything with homeopathy. So he doesn't know about these things about case taking. And the case taking thing which the Dr. Karnaka was about to take was a very rare and different thing which he was trying to. So very interesting thing in my clinic with children, I am very much amused, and I am quite very keen in seeing cases, because whatever the case is, whenever a child is entering my clinic, how the child is behaving, whether he is or she is a pulsatilla or naxomica or antimfruit or something else, we need to get from the symptoms, from the behavior itself. With that behavior and the common or general symptoms which we are getting, we can find the medicine with ease. But the generals and mental generals are very much considered essential and the topmost while taking a case by me in my clinic. And I openly ask you to have a discussion on this, whether you are giving more importance to the common symptoms of the case, or how you are dealing. And usually I have seen with lot of consultations and for several doctors' prescriptions that for a complaint itself, they will be writing lot of medicines all together and giving each intercurrently. and they're getting results, it's sure. But by taking the case itself and finding all the symptoms and simillimum when being selected on the generals and rare peculiars and the mental generals, physical generals and mental generals itself, we can go to the correct single medicine itself, and it's very fast, and it will take care of the situation as a whole. It's very easy. I'm doing it in my practice for the past 30 years. Never I have given mixed medicines, interchanged medicines or anything like that. In Kerala, in my place, a lot of acute cases are there. Daily is being pouring in, and never ever I have got any difficulties. And the success rate is almost above 90% in acute cases. Not, I am, I feel you will think that I am boasting of, and it's about 99% we can get the right result if we are sticking to the single medicine itself for the right, for the person selecting the right medicine itself. It's a great different. It's a thing to be explained in detail with more things, and I'll definitely I will take these things in another session. And it's not my session day. I am just moderating this session. And alas, we lost our connection with the trainer. And reading, and I'll add on another thing, reading Leaders of Nash. In that text itself, it was an eye opener for me. In the text itself, on medicine, explaining about some medicine, Dr. Nash was mentioning that never interchange a medicine. And if you are going to give arsenic album in the morning and giving in panic, we are going to give anitart in the evening. And in the next day, we are taking the case again. And if we are in panic and we are going to change another medicine, we will go in a disaster. We will definitely we will fall in a disaster. And never ever give aconite or belladonna to control fever. Because if belladonna is the case, we can give belladonna for that. If it is not, and if a high fever is there and we are going for belladonna or bacteria or anything like that, it's utter waste and it's absurd in homeopathy. And I think it's not a wise practice, because if sometimes we will get results with mild fevers and some simple thing of some simple acute diseases, we can do these things. But in more we need to, if we need to be very precise, we need to be very accurate, and we need to be very safe to make our patient safe. We need to stick to the cardinal principles of homeopathy, and we need to select the exact medicine by the simillimum, considering these rare peculiars itself. So these are the things which, while case checking, I got to know. And if the person is having a recurring, the complaint is being, every time it is being recurred, it is being coming back again, or another set of complaints is being coming, we need to be aware that the selection of the medicine is not right, and we need to think about some other medicine which we will be connected with the miasms, underlying miasms. And that's also very much, the doctor will be very much proficient on that. And after several years of practice and several years of this watching and trying to prescribe on the single medicine or the correct simillimum, totality, collecting the totality, after several years itself, the person will be very much proficient. Whatever the complaint is, whenever the person is inside the chamber of the doctor itself, we can perceive something, that we can get that notion that whether that person is this or that or anything like that. We can predict the medicine itself. Never get prejudiced. I am not saying about this prejudice stuff, because in Jan Scholten, very famous Dr. Jan Scholten, in his book Homeopathy and Minerals, in the preface itself, he is saying that this type of proficiency, this type of accuracy we can attain while when a person is entering the clinic, we can attain the proficiency. We can select the medicine by seeing the person itself, not listening to his complaint or anything. That proficiency we can attain by several years of watching, several years of penance in case taking and dealing the cases. I think it's now I am now doing a monologue, and we can have a discussion on these things. Dialogue is needed. We do have several doctors here in our forum now. Dr. Ganesh, Dr. Deepamala, Dr. Nirantar, Dr. Deepika, Dr. Harinarayan. And I welcome these persons. They can unmute themselves.
Yes, doctor, I have tried to call Dr. Karunagar, but he couldn't connect, and I think there is some network problem with him. So that we can have a discussion, I would like to suggest, because you can also join with me, since half an hour still remains, and we need to look into this kind of situations in a different way. Let me talk something about case taking for the time being. Yes,
We can.
yes, sir. Yes. As we all know that we are all homeopathic doctors. Not only we homeopathic doctors, whatever be the system of medicine, one need to look into the patient first. This is what lacking nowadays in the clinic. But 90% in the early part, 90% of the case were taking were done by doctors, and particularly with the talking with the patient. But nowadays things have entirely changed. 90% of the diagnosis or the treatment is planned after the so-called investigations. And frankly, as a homeopath, what we have to do is we just have to wait and see what the patient is behaving in front of, whether once a patient enters into the clinic, you can see how he acts and how he talks, how he behaves in front of the doctor, how he behaves in front of the bystanders, whether he is frightened in front of them, whether he is frightened in front of the doctor, whether he talks something loudly, whether he's talking very slowly, whether he talking very quickly, or whether he want to say something, or whether he simply sitting and doing some action. All these things need to be looking. This is what we used to say, that a homeopathic doctor must be a keen observer, according to Dr. Heinemann, and this is what most of us follows. But unfortunately, nowadays our doctors also treating directly with the pathological method. That is, they are going for diagnosis, and once the diagnosis is over, they then take the rules. It's a case of polycystic ovary, so we have to treat this, give this much of medicine to, or this is a case of bronchitis, or this is a case of pneumonia, like that. But frankly, whatever be the disease, it doesn't matter. As a homeopath, we will have to think about the situation, whether the patient is talking in a, for example, nowadays we have a lot of fever cases coming, as you all know that it is a rainy season, and during rainy season, most of the people are getting influenza like fever, and then a lot of people are coming. Some are saying that it is a variety of this COVID. But whatever be, as a homeopath, we need not to, there is no need to differentiate first, but we will have to take the case whether the patient is exposed to rain. That may be the cause. Sometimes the patient may be walking in a damp with weather in the water, and that may be the reason. So if you prescribe a remedy from that way, from the cause of the illness, that is, for example, from exposure to rain, so the patient may be given rust talks, and if the patient is walking walking in water during the rainy season, then we can think about this camera. I like that. So many, but in the meantime, we will have a lot of patients coming with the fever, with vomiting, and vomiting. When during vomiting, the patient may have thirst, and the patient may take lot of water. Still, he is having body pain, and still there is no relief. But in those conditions, we can think about eupatorium. But it does not mean that you have to give all these remedies all of a sudden, or but in all this case, we have a differentiation. For example, in fever case itself, we can use hundreds of medicine, not a single. Don't think that it is Rustox because it's a rainy season. We can take Rustox, but Pulsatile is a very good remedy for the influenza like fever. Then we can think about influenza in case of fever cases that are coming in. And even arsenic, we all know that arsenic is a very wonderful remedy and a very good remedy during this situation. For example, the patient is, most of the patients during rainy season desires hot water. So it's a common symptom as far as the rainy season is concerned. But when we look into when we ask the patient whether you take always hot water, no, doctor, during summer, I used to take cold water. So that means only because of this situation, he is taking hot water. So it does not mean that he is a chilly person. So we will have to differentiate. We will have to analyze whether the patient is chilly or hot at the time of consultation before before summer season or at the summer season, like that. Am I right, Dr. Indraj? Or what I'm telling is my own analysis and my own understanding of case taking. And sometimes some people always we very simply sit on the clinic and the bystanders may answer. Sometimes when you ask the question, the patient may be looking backward or turning around the head. In those conditions, we used to say that it can be a case of bariatric situation. But it does not mean that it is a bariatric case. In those conditions, even the case is fever, we can think of Baraitacarb. It does not mean that you have to give Belladonna. As we all know that Belladonna patients are, when a patient coming to us, the clinic, and the patient say, "Oh, doctor, he was very active just before. All of a sudden, he becomes so tired. You see how lazy, how tired, how this all of a sudden change in the act from activity to dullness. That condition with the intensity, it can be think of belladonna. This is a clue. That is a typical word coming from the mouth of the patient, not only from the mouth of the patient, but also from the bystander's mouth. But we cannot always rely on bystander's mouth as it is. There can be a situation, sometimes the bystanders may direct us into some way so that they want to take take us under their custody like that, because they want some even in some psychology cases, they are depriving something to the patient, and because of that the patient is unable to talk in front of them. So always, sometimes there may be mistakes. So in those conditions, we will have to take the case with the patient, with the bystanders, and without the bystanders. Then only we can. So what is what, and whether the patient is telling the right, or whether the bystanders are telling the right. All these things need to be analyzed in that way. And we would like to add sometimes when the patient is coming to the mouth and talking, when he started talking to you, you can some offensive odor may be coming from his mouth. Sometimes it may be from the dress. That may be a specific indication for some of the remedicine. That is also the duty. That is also one of the duty of the doctor to know. That is one of the indication for the right remedy. That also one point I would like to add. At the same time, the dressing of the patients. As we all know that sulfur is a patient is always coming to you with some ugly dresses, whether he is a rich person or even if he is a poor person. It doesn't matter much, but you can see ugly dresses in his room. But don't think that all sulfur patients are always wearing ugly dresses. There are patients who always wear some very, very beautiful dresses. But if you look at the inner wears, you can see, you can found that patient may be wearing some old thing like that, and that can also a clue to the medicine. Sometimes the smiling, the expression of the patient in front of you. Sometimes it may be the expression may be frightened one. Sometimes it may be very very mild, always smiling at you. For example, whenever patient phosphorus patient come to your clinic, you can see always he try to connect with the doctor in a sense that he is a very close friend of the doctor. Like the, oh doctor, your dress is very, Dr. Bendiraj, your dress is very beautiful, doctor. You looks very very young in your dress. Like that, the patient may talk like that. Oh, doctor, doctor, you can buy a golden spectacle for you, doctor. Like that, he always wants the doctor to be more smarter than what he is. That kind of, not only that, he sometimes touch on your watch and say, oh, doctor, how much it costs? It's a very good doctor. Like that, he is always having touching mind in the body. His mind is always touching towards the persons around us, not only with the doctor, but also to the patients, persons around. So these are the things that will rightly indicate you to the right remedy. So one need, these are the things that you get while you are simply sitting in the clinic. That's why Dr. Hahnemann and in our clinical case taking itself says that you just simply sit on the chair and observe and what others have to say, what the dog patient has to say. But nowadays things are different. We are dictating the patient to say this or that to make sure that our medicine is what we selected is the right one. But that is the wrong method. Instead, we just wait for the patient to talk, wait for the patient's expression, and the real we will have to find the real person in the patient rather than we just want to make a patient sulfur, make a patient pulsatilla. We can see that for example, when a pulsatilla patient comes to your clinic, you can see that she is when the mother or somebody says something, she all starts crying, and all of a sudden, when you say something like childish or something like that, all of a sudden the weeping stop and she started smiling. The ever changing nature of the mind, as well as that also is a clue to pulsatilla. Sometimes people believe that oh. Being a pulsatilla patient, she may not take drinks, water much. But frankly, there is no this. But still, if somebody asks her to take drinks, she will take. But only thing cold drinks. But she will not have develop any problem if she takes some icy cold water or something or juices like that. But sometimes if the person take this non-vegetarian diet, sometimes the fat may not be digestible to her, and as a result, she may develop some problem. So in those conditions, that's the reason why when some people come to the clinic and say that, doctor, yesterday I took some ice cream and all of a sudden she get fever or vomiting like that. That may be the reason. That means the fat inside the food that was not properly digested, and as a result, this problem is started arising. And so these are the things that one has to look into. One need to look into. One need to find out in the patient while case taking. Unfortunately, we people are not giving much importance to all these things, but instead we are still trying. Oh, it's a this patient. That's the reason why nowadays most of the junior doctors find it very difficult to move forward with homeopathy because they believe that, oh, this is a fever case, so we will have to give belladonna to this. She is having diarrhea, we will have to give pulsatilla to this. She will having sleepless, so we will have to give some califo, something like that. So a lot of medicines are being given at a time to get the patient, but that's a wrong method. But instead, we will have to find and come out to a single remedy as far as possible. And if you find it difficult, you can give the partial similar remedy at the time as the symptoms at the time of consultation. This is what I would like to say about the case taking from my part. And you can, so of course, we all know that sometimes patient may say, "Oh, doctor, I have sleeplessness." And then we can ask, "Oh, why you are having this much of sleep?" "Oh, doctor, when I started sleeping, when I start to sleep, all of a sudden some dreams comes in your mind." "Oh, what kind of dreams it is?" So sometimes the dreams may lead to the right remedy. So sometimes a patient may say, "Oh, doctor, when I started sleep, I may feel that I have to pass the urine." Then what may be the reason for you passing urine? You are a young man. "But doctor, sometimes I find there's some kind of dreams. Sometimes it may be a snake coming to me, or so because of the fear, I may have to pass urine, and sometimes I may pass the urine in the bed itself." Right. So that kind of mind, you can understand the mind by going into the depth of the case. And these are some of the point. And some of the advices I used to give, that is, if the patient is a chilly person, after case taking, we can understand that the person is a chilly person. So in case of fever like symptoms of fever or whatever maybe the acute diseases, during acute disease, I advise them better not to wash the head. And if the patient is a hot one, and the patient is tolerant to cold water, then I used to allow them to take hot water, the cold water bath. And these are the points I would like to add into the session. So these are some of the views on my part on case taking. And
That's great. I think so. The etiology, the objective, subjective symptoms, these should be considered, and a lot of things we need to be keen to be just watchful what the person is saying, what the person need to elicit, and we need to frame questions from that itself, isn't it, sir? From the answers itself, from what he is saying, we can't pre-plan anything what to ask for. So this is the thing the doctor should be keen in, intelligent in. He should have a wisdom on that.
exactly. This is what lacking nowadays. Because people believe that you have to treat quickly. But if you take a case in depth, definitely the patient will remember. For example, I have a patient in Hyderabad. They are very close to my family. It's a local person. But very recently, some 2 years back, the boy was brought to my clinic by his grandfather. Always he is having recurrent fever, and have need to admit in different hospital in Hyderabad. Last 1 month back, the patient parents came to my clinic, and all of a sudden they told me, "Oh, according to our child, you are a miracle doctor." They nicknamed me as a miracle doctor because they have that much of appreciation we get from a patient uh, when we take the case in depth. That is what because that kind of impact a doctor can make in the mind of a person. And I still remember some few years back, a boy, 7th standard student. After my case taking, he asked me, "Oh, doctor, are you a psychologist?" This is what actually each and every homeopathy doctor is just like a psychologist, because we are concentrating more on our mind rather than the physical symptoms or physical generals. But you just avoid all these things. You just enter into the patient. You can the patient will give you the right direction, and then you can end the choosing the right remedy, the right simillimum, and that will end up with the cure of the patient. And this is
And we need to allow the person to talk
yes,
and talk
yeah,
and talk, and after that he will say the medicine. We can take that medicine and give it to him. That's the
exactly,
beauty in homeopathy. We need to wait for a while that the medicine will be evolved by his speech itself, how he is eliciting these things. Excellent.
exactly.
Excellent.
Yeah. Exactly. We need to see that we must believe in ourselves that the person sitting in front of my is a person, is a medicine. Is the medicine I have to choose for him. But if we are not able to realize that, we will not be find the right remedy.
The other thing I need to add is that whenever a person is irritable, depressed, or something different, you are just mentioning about the psychology. You are whether you are a psychologist or not, a person. The thing ahead of that is our medicine counsel the person. The rightly chosen medicine need not need any other counseling sessions or anything like that. The medicine will itself will counsel the person and take the person to the right place itself. These are the wonders in homeopathy, isn't it?
Exactly. I still remember I have written an article some 20 years back in IHK News that homeopathic medicines are super counselors. And because I have a psychiatric a patient, that patient was really suffering from these uh, mental problems, and she was admitted every year. She used to admit in medical college hospital for at least 1 month like that. And once a person directed her sister to come to me and take medicine. I found that the indication, she was a typical right philosopher. I have seen that once in the corner of the my clinic. There is a junction, and she was talking like anything with the paper, bit of paper. And when this was in my mind when her sister came to me, I just gave her sulfur, then sulfur syrup and how it can be administered. That then I told her that you just dilute it in water and give it every now and then. Actually, after 1 week, when there was a housewarming function very near to the clinic, I was invited there. I was there when I reached there. She all of a sudden, the patient herself come to me and oh doctor, come on, we can have supper here. Dinner you can have biryani. That's very good and nice one like that. The patient is has no symptoms at all. But the most important point I have noted that the patient never developed this psychiatric problem thereafter. She lived up to 25 years more, and she died. At the time of her death, I was the person called in for confirmation of death. That kind of thing, that kind of miracle that can happen. That I never counsel her. I never talk to the patient. But the homeopathic medicine, that sulfur has given to her, and the sulfur worked beautifully. And as a result, the patient was totally cured. That is what we can call a cure. And otherwise, we may not be called that it is a cure. But this is a typical cure I have ever seen in my life. That was the most beautiful uh, uh, cure, I must say.
That's great, doctor. And these are the things we need to be aware of while taking a case to make our case a success. So these things which you elicited, which you explained to us, are really eye-openers for a good case taking, for a good doctor. And uh, uh, I thank all who are present here because the time is now ripe, and I think Dr. Dhanesh will explain a little bit more about our sessions which being uploaded in YouTube. Daily, these sessions, webinars are being uploaded in the YouTube, and you can watch. You can spread it to friends, colleagues. That this knowledge will be shared to vast audiences, and homeopathy should be in the forefront of the ailing person. For the ailing persons, we should make more persons aware about the benefits of homeopathy. Doctor, you can just explain, and you please, we need to conclude because the time is now right for the Malayalam persons to begin.
Yes.
So,
Yes, tomorrow we will. We stopped.
okay, so it's a time now to write the English session. It's we are handing over the session to Malayalam. Dr. Manoj is going to continue. Doctor, you need to make him